Join consultant urologist Mr. Ajayi in conversation with his patients as they share their personal experiences of living with BPH and undergoing aquablation therapy. Mr. Ajayi is a consultant for Procept Biorobotics and is compensated for his time. The statements in this video are those of the individual surgeon and are based on their personal clinical experiences with aquablation therapy. Results may vary and individual outcomes are not guaranteed. Talk to your doctor to see if aquablation therapy is right for you. Stay tuned to the end for important information on risks, safety, and potential side effects of treatment.
Welcome to the Men's Den. In today's podcasts, I have three incredible patients with me. Today we'll be talking about aspects of men's health, in particular benign prostatic hyperplasia, which is known as BPH. And we'll talk about treatment options for men with BPH, and in particular talking about the robotic technology called Aquablation of the prostate. If I can ask you to please just introduce yourself.
My name is Meacher.
I'm Nunzio Quacquarelli.
My name is Alireza, Sagharchi.
Welcome. The conversation with us today is really just to talk about men's health. This podcast is about Men's Den, and to talk about areas where we don't normally touch on, and where in the UK we're all very mindful and very cautious about having a conversation about issues that affect our male friends and colleagues. So, Harry, should we start with you? What was life like for you before your aquablation?
3 words, I think, would describe it. Fear, unease, and very uncomfortable.
Indeed.
And lonely, in a way, because I didn't find other men spoke about it. I think they seemed to suffer in silence, certainly in my experience.
Interesting. And it's interesting when you say lonely, do you want to elaborate a bit on that? What do you mean by that?
Well, it's something... I say lonely. My wife went through it with me, but she couldn't go through the physicalities of it. And so that was it. And I think the thing was this, I couldn't always put it into words, but this underlying fear. It wasn't, but it was always there. And whatever social situation I was in, I thought, God, will I be able to go to the loo? I mean, have I got to nip off somewhere? All sorts of things that were really I didn't want to mention it.
Absolutely.
You know.
I'm sure that really impacted your quality of life quite significantly.
Oh, yeah, sure. Yeah.
Indeed. We'll come back to that in a second. Nunzio, just to get your thoughts, really, what was your symptom complex like before we performed the aquablation on you? It's quite a journey you've had.
So I think I would regard myself as a typical male who didn't want to talk about ill health or symptoms like having to sort of go to the toilet in the middle of the night. So, I probably started to suffer nocturnia about 10 or 12 years ago, where I was suddenly feeling that I had to go to the toilet more often at night. And it was a gradual deterioration, almost to the point where I didn't notice it. It just became a habit that I'd get up a couple of times at night, and then maybe 3 times at night.
Right.
So it was happening. I just treated it as something I had to deal with. It was getting old. And then in 2022, my father had been diagnosed with cancer a year earlier, and he then passed away. And I think that stress caused me to develop prostatitis, which I didn't know I had prostatitis.
Yes.
But it just meant that the symptoms that I'd been suffering with over a long period of time became really aggravated.
Absolutely, yes.
And what was that like? It was horrendous. So, that urgency to go to the toilet, always having to check that there's a toilet nearby. And I go to a lot of conferences, I do a lot of public speaking, not very convenient at all.
Not at all.
So that was when the symptoms became bad. I took antibiotics, the prostatitis went away, it alleviated it somewhat, and then over a 2-year period, it gradually started becoming really bad again. And typical suffering in silence. Yes. But then I came to you and said, Mr. Ajayi, this is really bad.
Yes.
This is really bad. And in fact, you inspected my bladder and said, actually, you've got a growth. It could be cancerous. So that was my journey.
Yes. We'll come back and explore that because that's quite significant, and your journey so far and also up to date as well. Mr. Alireza, I just wanted you to share, I mean, you're 2 weeks out of your recent aquablation therapy, and it's great of you to join us. You're a week back at work. What was life like for you beforehand? I mean, when we initially met and your symptom complex prior to your aquablation?
Right. Well, actually, I didn't think there was anything wrong with me. I was always a hyperactive person from a very young age, which rushed to the loo every time. There was some activity. Exactly. I was irritated from day one.
Yes.
And I was a hyper person, and I took some of the things along as getting old, and you don't really know. You kind of fall into it without really noticing how many times you're going to the toilet, or when you get excited, or you have too many coffees, or you have a cigar and a coffee and and a brandy. Just say it's part of life. So as you know, I had an emergency situation where I a very large kidney stone decided to move in my kidney, and Mr. Ajayi came to my rescue on a Sunday, as it always happens.
Yes.
And once that was treated, which was my first. Actually, it's a baptism of fire, I should say, because I'd never been hospitalized in my life, never been under anesthetic, never been under anesthetic general or kind of a partial, and never seen the inside of an operating theater. And because of my father's prostate operation, I was going every year with a blood test to test my PSA. And there was nothing wrong for many years, so the GP said, well, you shouldn't really worry, it's not going to happen again. And my PSA had shot up actually the year before significantly. And that's how I fell into it.
Harry, having met you in my clinic, and I took a medical history from you, I don't think you've seen the inside of a hospital prior to that.
35 years. The first time I saw a doctor was just a few weeks before I was rushed into A&E.
Yes.
And then the nightmare, horrific tale.
Indeed. I mean, your experience in A&E, if you don't mind, you actually went to retention of urine.
Yeah.
And had a catheter fitted. And I remember...
Very painfully fitted.
And yes, and I remember us meeting for the first time, and I thought, gosh, your prostate was very large, very large. The average prostate in a man, it weighs about 30 to 40 grams. And if you don't mind me saying, your prostate was 180 something plus. So
I lost a lot of weight after that.
yes, all that kilograms were removed. So quite a significant enlarged prostate. And I'd be interested to get your thoughts really as to how your journey at the time of your in-hospital stay and post-procedure, how things were.
Well, like our dear friend here, I thought it was something, I never discussed it with anyone, but I thought what I gathered that most men past a certain age went through this and you lived with it. But with me, it reached the stage where I wasn't going to live with it because it was blocking my, I don't know, whatever it was, kidneys. Yes. I couldn't function. I couldn't pee properly. There was a water retention, as you know. Chronic water retention was building up. And I didn't know.
No.
I just thought, I've not been eating that much. Why am I putting on all this weight? Then it was released. But I didn't get any satisfactory answer from when I was in hospital from NHS doctors. I think there's several that came round. And I just wanted to know, where do I go from here? I had this catheter in, blood was pouring out. They said, that's normal, that's normal. Didn't seem normal to me.
No, far from it. Far from it.
And I kept saying, well, what is the alternatives? Not one single one of them mentioned aquablation. None of them. They said, oh, you'll have to have an operation, or you will have to go surgery. And these words, I mean, I found them terrifying.
Yes. I mean,
Yeah, and I had a similar experience. So when I developed the prostatitis, I went to see I was actually in Slovakia with my wife at the time, so I went to see a urologist in Slovakia, and he said I had thickening of the bladder. He said I didn't have a particularly large prostate, actually. But he said, the typical treatment would be TURP. And, that involves cutting away. And so I like researching, so I went and did a little bit of research about the impact of TURP and realised that the implications are actually quite horrific. So I chose to wait And as I said, I left it for another 2 years. Then I went to a specialist in March of 2024. And he actually didn't do any investigation and said, listen, you're just getting older. Yeah, I was 60. And yeah, this is just a part of getting older. There's nothing you can, they actually said there's nothing you can do. He actually said that there's nothing you can do. You have to live with it. I actually decided that I wasn't satisfied with that. So I went to see Mr. Ajayi to get a second opinion. And that was at the point where we investigated, we identified that there was a growth, etc. And then we started to look at the broader.
Indeed. I mean, you did a lot of research. And so having a conversation with you about aquablation was very straightforward. It's like talking to another doctor, actually. So it was very straightforward.
Well, I'd like to think that, I challenge advice, which is why I came to see you in the first place, because I was challenging the advice I'd received. If I'd accepted that advice, I could well be dead now. Let's be real, honestly. So one of the reasons I'm here is because I want to encourage people not to be embarrassed about facing up to their issues and actually getting advice and seeking advice and challenging opinions if people say you can't do anything about this, because that's a nonsense.
Yeah, I mean, it's
what I find slightly disconcerting is both these two dear gentlemen, it all rested on you. You were the sort of saving angel, if you want to come, which is pretty sad if that's just one person. Do you know what I mean?
I mean,
Julie and I sometimes at night think, what would we have done if we hadn't met you?
Well, that's. I'm sure there are a lot of good doctors out there, and a lot of you're perhaps slightly unfortunate in those circumstances. But really, we have technology now, and for me as a urologist, having a technology that kind of delivers for our patient is also quite unique, and it's quite a unique experience when a particular technologies says they can do certain objective, and to achieve those objectives is very rewarding. And to see the outcome of those objectives is also very rewarding. And perhaps why you all kindly give up your time today to sit with us and have a conversation with us on men's health. But it's interesting. I'd like to understand really in terms of your post-procedure experience. Obviously, when we first met, you had a catheter, Harry, and by the time we did your procedure, my anxiety initially was, will you pass urine straight away? And you did, and you've been peeing, and hopefully life is back to normal. But I'd like to get your view on that post-aquablation.
I think it's gone back to 20 years ago, the way it was.
Really? 20 years ago?
Wow. In every way. I've never had any form of, like you, anaesthetic or being put out or had any operation. And it still took me, because of my experience in NHS, even getting over your non-invasive operation, I think, my God, what must it be like to have an invasive operation? And so this, to me, is a miracle of technology.
So it's interesting about the aquablation. The NHS, the adoption in the NHS has been a slight challenge. To my knowledge, there are 15 NHS hospitals now that have aquablation, and there's a number of other NHS hospitals in London and beyond who are currently looking at developing aquablation therapy in their service. So it is available in the NHS. It's just limited at the moment. The NHS is going through quite a difficult time, but I'm sure with time there'll be increasing proliferation of aquablation in the NHS. So hopefully free for all men.
The outcome was fantastic. Immediately able to pass urine with a strong stream, which I hadn't done for quite a few years beforehand, and just the ability to sleep through the night was transformational. The level of well-being you get from being able to sleep through the night versus having to wake up 3 or 4 times. So tremendously effective treatment, and I haven't identified any negative repercussions from it, which I think is a testament that it's a really well-designed piece of technology that is really effective.
I must say, at the end of our consultation after your first follow-up after you had your aquablation, you gave me a statement which I must say made my day. You probably don't remember it, because you left the room and said, "Oh, Mr. Ajayi, I'm just letting you know you're onto something pretty special here with this aquablation." And those were your passing words.
I agree. I'm here not to promote aquablation. I'm here because I think people have a right to understand that there is a solution out there for something which most people are embarrassed about.
Indeed.
And I would recommend it.
Indeed. I would like to come to Alireza. Your aquablation was just over 2 weeks ago. In terms of your recovery, I mean, some patients, they ask after other forms of bladder outflow surgery, take 6 weeks off work, take time off work. Yes. And you're a very busy man, I know that. And the fact that you went back to work within, just after a week, that's something in itself, isn't it?
Yes. I think one of my main issues was how much I'm going to be out of action, because I have a very busy office and people rely on me. So I needed to be available. I was texting and WhatsApping while I was on the hospital bed. But when I decided to do it, I found a window and I said, I'm going to do it. Yeah. And I'm a professional in a business where I get a lot of people to whom I give advice, and they tell me, well, so-and-so told me this, what do you think about that? Or such and such, I read here. And up to a certain point, I think it's very good, but then you have to put your faith in a professional. And if you find the right person and you see how they're treating you, which I had through the kidney stone, for me it was a no-brainer really. And I thought, if I'm going to do it, I'm going to do it now, while I have the strength to deal with the post-operation trauma, if there was any, and any other issues that goes with it. Post-operation, I was out within 24 hours. So I had the surgery on a Friday, I stayed on a Saturday, and I left on a Sunday. And I was passing urine, obviously with the blood and everything else, but I didn't have the catheter at home, so I've been well. Yeah. But most surgeons, with all due respect, are quite optimistic. The sun always shines when they talk about the post-operative world, etc. And with my kidney stone, probably it was a bit unrealistic, but because I had a lot of pain and I wasn't expecting it, and I was saying, well, is he kind of downplaying it now for aquablation? But I was surprised. I was pleasantly surprised at how easy it was afterwards. But I'm realistic. I've taken all the precautions. Men obviously don't wear pads. If you have to, you just have to, and you have to do your research about. I'm going to drive to Switzerland on Saturday, on Famille. So yes. I've kind of looking at all the stops.
Plan the toilets along the way.
Exactly. So I think one has to be realistic. It's however you spin it. It is an operation. It's invasive. It's something that not every day happens to people every day, and you have to be realistic about the post-operative period. And I think it varies from person to person. Like all
So aquablation's obviously been around a little while now, and we talk about patients who have TURP, which is thought to be one of the standard of care in the NHS. We talk about surgical rate of 10% in 10 years with TURP. Aquablation's been around almost a decade now, and looking at the literature, it's very much a durable operation, and very few patients have had to come back and having a redo operation in that period of time. So it is sustainable.
Do you think that is?
Well, I think it comes down to the technology. If the technology is you're ablating a significant volume of the patient's prostate, and if you do it sufficiently enough, and you hope that you've created a good enough cavity that would hopefully last the patient's lifestyle. We do know the prostate continues to grow, irrespective of what you've done, unless you've removed the prostate in its entirety. I had a radical prostatectomy. It will regrow. But aquablation has been around a decade now, and as far as we know, looking at the literature, it is durable, and the recurrent rate of having to have secondary operation is very few patients are having to have that at the moment. So it is here to stay.
What about the preventive thing you mentioned? Well,
it's interesting. Prevention of benign prostatic hyperplasia in men. I don't know whether you all know what the prostate does. It helps with the secretion of and looks after this ejaculate. Good when you're a young man. A problem when you're an older person. And often patients ask me, how do you prevent prostate disease, be it prostate cancer? And in the prostate, a number of nutrients, zinc, selenium, etc. So there are very dietary things that one can do that helps. In the Mediterranean, the incidence of prostate cancer is quite low. And it's thought to be due to the little cherry tomatoes, the pomodorinos, the small...
More tomatoes.
Indeed. It's full of lycopenes and antioestrogens and lycopenes. And these lycopenes and antioxidants gobble up oxygen-free radicals in cancer. So a Mediterranean diet is thought to be very good. A fish diet high in omega-3, vegetables, salads, the Greek and Italian Mediterranean diet is thought to be very good at preventing prostate cancer. So these are things we encourage our patients to take on board, especially during the summer months. How did you think about it? Obviously, when you had a catheter, you were like, doctors, sort this out.
I was so traumatic and traumatized. That's what took a while. The actual aquablation was brilliant. No problem at all. But
yes, you're still traumatized by that, the NHS experience.
I was at least 6 weeks where everything was functioning normally, but I was tired. And I thought, well, why? I mean, I'm showing no symptoms or anything. And I think it was just the trauma that I'd gone through before, not the aquablation operation.
Indeed. And how are you feeling now?
Well, I'm here.
Yes, yes.
Join the club.
Indeed. Okay. And how your recovery? You told you're off to Switzerland.
Yes, yeah. I'm trying to resume normality, whatever that might look like.
And it's always interesting.
I think you have to come into terms with your body and your limitations.
It's interesting. I mean, people say you have prostate surgery, you need to remain in the country for 6 weeks. The fact that you've gone back to work week 1 after
is that really the advice?
Well, that's something in the NHS. We often tell patients, put your feet up for 6 weeks or so. So you've gone to work within a week, and in 2 weeks later, in a week to 3 weeks, you're leaving the country for a holiday, which is quite encouraging.
Yes,
and it's a mindset as well, isn't it? Would you say?
Well, I think so. I think psychologically and physically recovering, I think, is very important. You have to recover psychologically as well as physically. One feeds the other.
Indeed.
And gives confidence. If your body is performing psychologically, you feel better. If you're in a better mood or a more positive attitude, your body picks up and goes forward. I think it's important to look at both. And don't push yourself where you don't need to be pushed, and don't take it too easy either.
Right.
Because otherwise some things become habitual, and then you still groan when you bend down to pick something up. But
I don't even recall, but I was speaking at a conference 10 days after my...
I know you were at. Yes, I remember that.
Maybe it was a bit of a risk on my part.
I was very anxious for you, I have to confess, because it was quite a big conference you were going to, and I was hoping you were going to be fine, but you came back.
But I also had a bladder resection.
Indeed. I remember very well.
It was a dual operation.
Correct. And I remember
I was
very
okay.
well. Absolutely fine, which is good, which is always good to hear. In terms of advice, we're here really having a conversation on men's health. We haven't really touched on prostate cancer, and I don't think this is necessarily our remit. It's more to do with the benign aspect of men's health, an area which is poorly touched on. In terms of advice, though, what advice would you give patients? You're several weeks now into your surgery. After your surgery, you're back to hopefully normal functionality. What advice would you give your friends who are also having a challenging time like this?
Look into aquablation.
Okay,
I mean,
that's first
the
thing.
one advice I'd give them. Forget everything else, just because I can only go on my experience. And my wife looked at some of the other alternatives. I couldn't have contemplated it. I mean, I'm a physical coward.
Indeed.
And
Well, your picture of health. Indeed.
So, no, and check it out now. Do it now.
And Nunzio, advice to patients, advice to your friends who might be suffering in silence. Any thoughts on what they should do?
Don't be embarrassed if you have these symptoms. Definitely get expert advice. Go and see an expert urologist. Aquablation may not be necessary for everyone, but it's definitely, if you have severe symptoms, the best option I am aware of.
And also, the message I've also got from you is don't necessarily believe the first doctor you see, because medicine is such that it's quite diverse in thinking, and the fact that one doctor tells you this doesn't necessarily equate to what is right for yourself. So you've got to do what's right for you and seek the best.
And listen to your body, which a lot of men don't.
Interesting. I think that's quite a strong message. Listen to your body. And a lot of men suffer in silence, and the way to their symptoms get worse. Getting up several times at night is considered the norm, and it isn't the norm. It isn't the norm.
I think it's also a fear. I think, at least for my generation, having prostate surgery meant loss of continence, loss of sexual function. So, and that's kind of being almost castrated in your. So people try to put it off as much as possible, and they say, "Well, I'll bear with it until actually it doesn't really matter whether I sexually function or whether I need to get up 4 or 5 times a night. I think that's one of the things that stops people being open with themselves and saying, well, I have a problem. And now that there is something that actually doesn't have those repercussions, why not?
The misconception is if you have prostate surgery, the side effects are quite significant.
Correct.
Whereas with technology like aquablation, we're hoping that will shift the thinking and allow men to come forward quite openly to discuss these sort of things. So I have to say thank you very much to all of you for giving up your time today. It's been a real pleasure. You are all absolute incredible patients. You give me so much energy and passion to my work, engaging with you and all the time. So I thank you very much for this afternoon coming to talk to us about your experience with aquablation. Just to conclude, is there anything, can I just have a couple minutes from each of you? Any comments, any final comments from you before we close this podcast?
Everything positive. Everything I can think of. I think it's a miracle of technology in the right hands. So.
Thank you very much.
Yeah, I would second that.
Okay, thank you.
Yeah.
Excellent. Well, thank you all for giving up your time today and for sharing your experiences with aquablation with us today. Thank you.
For more information, please visit aquablation.co.uk. The information included in this material is being provided for informational purposes only and is not a substitute for the independent medical judgment of a physician in assessing treatment and management options for a specific patient. The information is not intended as a recommendation or endorsement by Procept Biorobotics of any particular treatment method unless otherwise expressly stated in the product's user manual or instructions for use. The handling physician is solely responsible for all patient care decisions. Risk and safety information. Aquablation therapy is performed by urologists. Patients should talk to their doctor to determine if aquablation therapy is right for them. Patients and doctors should review the potential benefits and limitations of treatment together. All surgical treatments have inherent and associated side effects, some of which may lead to serious outcomes and may require intervention. Individuals' outcomes may depend on a number of factors, including but not limited to patient characteristics, disease characteristics, and/or surgeon behavior. The most common side effects are mild and transient and may include mild pain or difficulty when urinating, discomfort in the pelvis or penis, blood in the urine, inability to empty the bladder or a frequent and/or urgent need to urinate, and bladder or urinary tract infection. Other risks include but are not limited to anesthesia risk, sexual dysfunction, including ejaculatory or erectile dysfunction, injury to the urethra such as false passage or stricture, or to the rectum, including rectal incontinence, perforation, bladder or prostate capsule perforation, infection, including the potential transmission of blood-borne pathogens, bleeding, incontinence, embolism, electric shock burn, transurethral resection syndrome, bladder neck contracture, and bruising. No claim is made that the Aquabeam robotic system will cure any medical condition or entirely eliminate the diseased entity. Repeated treatment or alternative therapies may sometimes be required. For more information about potential side effects and risks associated with aquablation therapy, speak to your urologist or surgeon. RX only. Gilling PJ, Barber N, Bidair M, et al. 5-year outcomes for aquablation therapy compared to TURP. Results from a double-blind, randomized trial in men with LUTS due to BPH. Canadian Journal of Urology, 2022, Volume 29, Issue 1, pages 10,960 to 10,968. Copyright 2025, Procept Biorobotics Corporation. All rights reserved. Aquablation, Aquabeam, Procept Biorobotics, and the Procept Biorobotics logo are trademarks and all registered trademarks of Procept Biorobotics Corporation.